Hi everyone, I'm just waiting for Dr. Ghadir to pop on and he is going to tell me the results of my AMH test. So for anyone who doesn't know what an AMH test is, it's a simple blood test that basically gives you, oh, I see him. A basic blood test which gives you an idea of your egg count. So I took this test last week and the results came back. Hi, doctor.
How are you, Rachel?
I'm good. I'm so good. How are you?
I'm good. Thank you so much. Thank you so much. Let me just kind of move this a little bit. Awesome. I'm good. Thank you so much. I'm really excited to talk about the AMH. I heard you just kind of announcing to everyone what the AMH test is.
Exactly.
And I think it's a really good way to start this little discussion.
I think you'll do a
AMH
much better job at telling us what it is. So you want to start there?
Yeah. So the AMH test stands for anti-Müllerian hormone. It is the blood test that comes from, it's the hormone that comes from all of the eggs in the body. So what that means is if we get a high level of this hormone in your blood test, then you have a good number of eggs. If we get a low number of this in your blood test, it means that you have a low level of eggs. It's the #1 most important blood test that I would be recommending to anyone to start when they're doing this process. I think it's a really, really good process point to do and see exactly where you are in the process of kind of knowing where your fertility is. And it's a simple blood test. You can do it any day of the month. You can be on birth control, off birth control. You don't have to be on your period. You can do it whenever you need to.
To me, it feels like something that we should just kind of start doing as part of our annual health checkup, from like our mid-20s or something.
I think that every woman, I mean, in an ideal, perfect world, it'd be one of those things that you do once a year, starting at 20, you start to follow that number. It tells you exactly where you are. I think it's a great, great idea.
Okay, amazing. And I can truly attest to the fact that it was so quick and easy. Do they call it a phlebotomist? Whoever took the blood was like, boom. It was so quick and painless. It was really easy. So yeah, so you got the results.
So I got the results. Is that okay if I say them, the number?
Yeah.
Okay. So Rachel, your AMH level was 5.64. It's a phenomenal number. It's telling us that you have a very high level of eggs. And it's a very, very good number. It means you've got a lot of eggs.
Okay.
I don't think you have to worry about your eggs, and especially for your age category, it's also a really good number. It does say that for some levels above 4, and I've seen it sometimes say above 6, sometimes it could be a hint of what we call polycystic ovary syndrome, and that's the syndrome where people don't ovulate so well, and sometimes they have difficulties getting pregnant. Sometimes they have excess hair on their body. Sometimes they have some hair loss on their head. Sometimes it causes acne. Sometimes it causes darkening.
She's like my moral support. She came through the test together. Girlfriend,
I love it. I don't have a moral support with me. What am I going to do?
Yeah, which is another thing, guys, we recommend. If you're a bit scared to do it, just go and we have lunch with your friends.
Yes, and Rachel was holding my hand.
Yeah, we held each other's hand and there we go. Okay, will you tell us the symptoms of PCOS?
Yes.
Because
there are quite a few symptoms. One main category is when you do an ultrasound, the ovary looks very polycystic with lots of little cysts all over the ovary. So that's why it's called polycystic ovary syndrome. The next one is having an elevated level of male hormone in the body. It could manifest itself as many different things. Very commonly, it's hair on the chin. It could also be acne. It could also be hair on the body, around the breasts. It can also be male pattern baldness, where you start to lose hair in the front of your hairline. It can also just be that on a blood test, your testosterone level is high. It's kind of hard to have the blood test positive and high and then have no symptoms, so that's kind of rare. Okay. It can also affect your menstruation, and people have irregular cycles.
So far I have 2 out of the 3 or so symptoms. I have the acne, which everyone's kind of been following. In the last few months, out of nowhere, I just had the most insane acne. and my periods have been really irregular. I think probably like every, I don't even know, it's probably been about like 7 weeks between.
Well, normal periods are generally between 21 and 35 days apart. Once they get to be more than 21 to 35, like 35 or more, or they're just bouncing up and down, that's kind of one of the signals about this.
Okay.
So those are really, and I got to tell you, I think that it's a major spectrum. So PCOS is a major spectrum that kind of looks at people that you would never tell that they had PCOS, and they're walking around and, you know, could be on the very low edge of having 1 or 2 tiny little symptoms. And then you have the major symptom of people that are, you can kind of tell from, I can tell as a specialist who's done my thesis in this area, you know, if they have a lot of hair growth, they have a lot of acne, the darkening of the skin of the neck, under the axilla and underneath the breast, the inner thighs, those are the first signals to us that the body's insulin is not working as well. And it's not dirt. It's in no way dirt at all. That kind of velvety brown, which you don't have at all. Which you don't have at all.
We're checking ourselves. You look good.
It's examination time. None of that, you know, all of that basically, I have to say, I think those are all signals to me that people have stuff. Now, the underlying problem with people with PCOS is basically that a lot of these people do have insulin problems. And the insulin receptors and the male hormone receptors like testosterone are very similar. So your insulin's not working well, you get extra testosterone, the testosterone binds the insulin, and it's just not working well, and the system isn't doing very well. So for that reason, I'm going to jump into some minor treatments, because there is no real treatment that cures PCOS.
Okay. Wait, can I ask about one more symptom? I Googled it after we spoke. There was something said that pelvic pain can be a symptom, because I've been like having some, no, it can't be. All right. No. So that's something else I need to figure out.
Pelvic pain is definitely not a symptom. That's why you asked a doctor
and not Google.
And yeah, thank you. Dr. Google was wrong again. So
okay, so
pelvic pain is not.
Okay, that's something else I'll figure out.
Yeah. It could be from other reasons of not having a regular period and falling behind. Those things can cause discomfort.
Okay.
But moving forward to some of the treatments. So if you're not trying to get pregnant, many people think that if you're on birth control pills, kind of just normalizing your hormones. And it's true. It brings your male hormones down. You cycle regularly, and you can do very well. I'm sorry. Let me just... I'm sorry about that.
It's okay. You've got the phone. We've got kids in the background.
I didn't do my do not disturb. I apologize.
We've got a 5-year-old babysitting a 13-month-old.
I wonder how is it going.
Hopefully they're still alive.
I totally get it. So I was saying, okay, so treatments. The birth control pill is probably the #1 treatment that people do. There's also a medication called spironolactone, which is actually a diuretic that brings down testosterone levels and decreases all of the things that high testosterone does to you.
Okay.
So it can be...
Sorry to interrupt. Interestingly, I went to the dermatologist last week to ask about my acne, which again, I'm not thinking any of these things are correlated. I came to you about eggs. I was going to the dermatologist about acne. She prescribed me spironolactone for the acne.
So you're not supposed to be on spironolactone alone. You're supposed to be on spironolactone along with birth control pills. Okay. Because the risk of being pregnant and on spironolactone is really bad. Okay. There's a lot of side effects that cause abnormalities in your offspring if you're on spironolactone.
Okay.
So a very smart doc would always put both of those at the same time.
Got it. Someone actually in the questions just asked, hi Katrina, she asked, can you be on that drug and get pregnant? No.
Absolutely not.
On that
It's a very dangerous medicine to be on to do that. But the next question that I saw was metformin. That's the third medication that I think is incredibly helpful, because metformin, when taken in the correct dosage, okay, and you got to talk to your doctor. For someone who did their thesis in PCOS, I was trained to get people up to 2,000 milligrams of metformin a day. Many people come and see me and their doctors put them on one pill, which is 500 a day, and we don't really see much benefits.
Okay.
Metformin sensitizes your insulin to work better. And the more sensitive your insulin is, the better it works and the symptoms start to come down. Additional stuff about metformin is that, unfortunately, it really upsets people's stomach. So people can use it as an opportunity as their body's getting used to it, because they get a little nauseous, it can cause stomach upset, diarrhea, bloating, nausea, all of these things, and makes your insulin work better. So it's a great opportunity to try to lose a little bit of weight while on it. And
Right.
I think weight loss is probably the #1 way that we see improvement with PCOS. Many people whose insulin's not working well, or you don't know, maybe they gained weight and then their insulin didn't work well. It's not really sure if it's their insulin didn't work well and it caused weight gain. But when they control the diet, lose extra fat, it really can improve the symptoms as well significantly. So we've got birth control pills.
Mm-hmm.
We have spironolactone, which is also sometimes called aldactone. Okay. We have the metformin, and we have the weight loss.
Okay.
So these are all things that could be helping someone when they're trying to treat their PCOS. The weight loss is the one that even if you lose 10% of your weight, so if someone's 200 pounds and they can lose 20 pounds, it's been shown to have significant improvement in that.
And it's interesting because I don't know if it's like quarantine, I'm moving less, and I'm just like, my diet was just like, yeah, I'm not seeing anyone forever. I'm going to eat whatever I want. But like, I've been eating like a maniac. And it's interesting because now the timing, it kind of like goes hand in hand with like the acne and then like the irregular periods, like all of that does sort of correlate with my weight gain.
So I got to tell you something. I really am a firm believer of what you put in you is what comes out of you.
Yeah.
So you put fresh, healthy, good food inside of you, and you watch what you eat, and you don't indulge overly. You know, it's a nice balance because I've got a major sweet tooth. Everyone who knows me knows that. And both of us, as you can see, you saw me like devouring chocolate chip cookies not too long ago. But with that being said, I think it's really important for someone who's caring about being pregnant and who needs to be pregnant and is having a hard time to take control of all of these things.
Okay. My next question is, so you obviously mentioned PCOS as being an issue when a lot of people are trying to get pregnant. And then there are people asking in the comments, well, so if you can't take these drugs you've mentioned while you're trying to get pregnant, how do you kind of deal with that if people are trying to treat their PCOS in order to get pregnant?
So you can definitely take metformin while trying to conceive.
Okay.
Many doctors like to give Clomid, the ovulation pill, and the metformin at the same time that you're taking the metformin to help you even have a better response. Some studies showed that just metformin, a Clomid on its own, which is an ovulation medication you take for 5 days in the beginning of the month and helps you ovulate, alone does not do as well as it does when taking it with metformin every day. Okay. So you can take the metformin every day, and generally speaking, once you become pregnant, we wean you off of it very quickly. Okay. But it's not a medication that's very unsafe at all when getting pregnant. The spironolactone is more for the symptoms. So the acne, the hair growth, the excessive testosterone, and that you cannot be on while trying to get pregnant.
Okay, got it. How much of a gap? So I'm not trying to get pregnant now. What combination of drugs would you recommend for me? And then also, if I'm going to take this, well, I'm taking spironolactone already, prescribed by my dermatologist. How long should I stop that and wait between trying to get pregnant?
So for yourself, Rachel, for someone who's like yourself, so for someone who's not trying to get pregnant right now, Rachel, I would recommend for you to be on a birth control pill. I would recommend for you to be on the spironolactone, and I would start taking the metformin. The metformin, I generally tell people to take one at dinner, slowly for a few days. If you're doing okay and you're not dying from stomach upset, you can add a second one with breakfast. After a few more days, if you're doing well, you'll add the third one with lunch. And then if you're really doing well, by the time you add the fourth pill in, you can do like 2 with breakfast, 2 with dinner. Okay. So that is also really important, okay?
For how long do you think I'm going to have to do this?
I don't know. You know, you do it. There are people that are, this is their daily regimen that they do, and it's not like you do it for a month, it's gone, and when you go off of it, a lot of this stuff could come back. But I would do it probably until you're ready to have a baby.
Okay.
Then I would stop the birth control. I would stop the spironolactone, and the metformin I would continue until you had a positive pregnancy test.
Okay, sweet. Let's answer a few questions about PCOS.
Sure.
And then, okay, someone's on metformin.
And someone just asked, what about inositol? It's a vitamin that's been shown to be helpful for PCOS patients. I have nothing against it. I would recommend it, but it's just a supplement.
Okay. Does birth control pill cause weight gain?
No, it does not.
Does it make you a little, I swear it makes me a little bit crazy. And like,
so some people, it affects your hormones, and the hormones. So some people on birth control definitely get affected. Definitely can get affected. Okay, so by mentally but birth control has been shown to help people, or unfortunately not help, but it retains water. So some people feel a little bit more bloated when they're on birth control, but it should not be making you gain weight. And neither do prenatal vitamins. So many of my patients don't want to take prenatal vitamins because they think it makes them gain weight. And these are myths.
Lies. Okay. The next question, is the AMH test expensive? I'll add to that. People have been asking me if insurance, if it covers, if many insurance.
Some people's insurance covers fertility tests. Some people's don't. It can range anywhere from your insurance covering it to about $150. So it really ranges.
That's super affordable, though. $150 to.
I mean, I think $150 to see how fertile you are is probably the best $150 you'll ever spend.
Agreed. And then someone asked, how do you feel about intermittent fasting for insulin resistance?
So there's been a lot of data that has shown intermittent fasting has helped. I had my doubts about it. I did speak to one of my friends who's a specialist in it and recommends it. So there definitely is some benefits to it. It's not for me. Like, I can't miss a meal. Yeah. Unless you want to see me crazy. I don't think it's a good thing to do.
Same.
And, I think you have to know your body. There are some people that just cannot stand eating breakfast. And I don't know, for some reason, I see a lot of people that don't eat breakfast and they're all overweight. So I don't know. I'm not an expert on intermittent fasting, and I'm not really sure how to answer that.
Sure. We don't have enough evidence yet.
Yes.
Recommend it. Somebody else is asking why they get closed up pimples underneath their skin before their period.
Why do they get pimples?
Like, I guess cystic, like underneath the skin.
It's just one of those things. It is one of those things that many women get before their period comes, with that hormonal change, with their estrogen beginning to drop rapidly, progesterone going up. People get acne.
Okay. Cool. I think we last question about birth control. Is it normal for it to make you nauseous?
It shouldn't, but some people get nauseous. If it makes you nauseous, I would ask your doctor for a different brand. I would take it at a different time of day. I would take it with food. All of these things are rather important.
Okay.
And try to find what works best for you.
Awesome. And then another question, someone's sort of asking me, I think it's a good question. For PCOS, we almost sort of discovered this a little bit by accident. I guess I wasn't really looking for it with the results of this AMH test. Is the AMH test, if someone suspects that they might have PCOS, is this the first test that they should take? Or is there a different test?
So AMH it's a hint. It's a hint at PCOS.
Yeah.
It is not part of the diagnosis process at all.
Okay.
And it's definitely not part of the workup or the real recommendations for what needs to be tested.
Got it.
It's similar to LH hormone. When the LH hormone is kind of higher than the AMH, than the FSH hormone, it gives me a hint that someone may have PCOS, but none of these are part of the official process of diagnosing PCOS.
Awesome. Really interesting. I hint we'd have to explore other things to actually
Absolutely.
Okay.
Absolutely.
Cool. And then I think the last question, someone asked, do you see any other ones in there?
Well, someone said about their thyroid being 6, and I got to tell you something. The importance of having a healthy thyroid, meaning your thyroid stimulating hormone, or the TSH, being at around 2 while being pregnant or trying to get pregnant is really important.
Okay.
And sometimes we find that the TSH, when it's out of whack, it throws all the other hormones out of whack as well. So I think that's really, really important as well.
It seems to me like people should just be able to get some of this information almost before they start trying, rather than waiting, whatever they say, like a year of trying naturally.
100%. I think
some of this
waiting,
basic info.
if you see some of these symptoms and you're waiting a year, I think you just lost the year of your life and the year of your fertility.
Yeah.
I did want to say, Rachel, before we get off, if anyone wants additional information, if they go to our website, which is SCRC-IVF.com, Southern California Reproductive Center, IVF.com. We have a lot of information about this topic there.
Amazing.
And if anyone wants to sign up for our free educational webinars, we always touch base on a lot of these topics again on those. They can sign up for the ones that I'm giving. They can sign up for the ones my partners are giving, whatever works for them. So we're more than happy to. And I did want to say that right now, during this whole process of COVID, we have some specials going on for consultations. We brought them down significantly, and we're doing them by phone. So I have had the best time talking to people around the world. I saw people saying hello from Croatia. I saw people saying hello from Italy. It's sad. Today I was supposed to be on a plane on the way to Italy, and all canceled. But next year. Next year. Next year.
Okay, my last question then before we hop off is, going back to sort of the egg count, away from the PCOS, what does that sort of mean for me and like how I think about family planning? If I want to have not just one more, but like essentially maybe like 3 kids, like what timeline what's my timeline? Give it to me straight. Like, what am I working with?
The way you answer this question is very different for different age categories. So if you were in your 20s and you wanted to have a kid next year, and then another one like when you're in your early 30s, I'd say you're probably going to be fine. If you're in your mid-30s and you're not going to have a kid for a few years, many of our patients after the age of 35 or in their mid-30s start to have problems conceiving, and then you still want one more after that. So there are many people that either freeze their eggs. We have a summer special going on for egg freezing right now, which is amazing, the best I've ever heard of and the best that's out there. We have another special going on for consultations, and we are helping with reduced prices of IVF right now. So if you wanted to put your embryos aside and make embryos, it's a perfect time to make embryos and leave them there, and then you can use them for the rest of your life.
And
so
something.
Yeah.
No, because I'm 36, and when I questioned my gynecologist about freezing my eggs, it was like, yeah, but you know, if you want to do it fast, because they're already like old your eggs. And I was like, oh my God. So is it like completely useless to do it at 36, or is still like better than that?
So we've had, I think our oldest patient who froze eggs and used it and had a baby was 44 years old. Some people do well in their 40s. Some people by their mid-30s, they're not doing well at all. Some people in their early 30s are done. But I think that it's an important test to do and see if you have eggs. If you have eggs, you should definitely freeze your eggs. And I think that if a lab is telling you not to do it at the age of 36, the fertility clinic, I don't think they're doing such a great job.
Can I ask you also another thing?
I love it.
Because when I was researching about freezing the eggs, I found out that most of the people that freezes their eggs end up not using them. And I was thinking like I wouldn't care, because I guess people doesn't care. You know, it's just an opportunity in case they need it. But
yeah,
is there a way?
Also, I want to tell you one thing, Bianca.
Yeah.
There's a lot of people that get car insurance and they never get a car accident.
Yes.
Okay. So
better that way, no?
Yes.
But no, I was wondering if there was a way to donate your frozen eggs.
I think there is.
Right?
I've heard of that.
Your eggs, your sperm, and your embryos are your belongings, and they go into your will. So you can decide to give them to someone. The ideal age, if you have a friend to donate, great. But the ideal age to donate eggs is between like 20 and 30. But
they don't want our eggs.
Let's say.
But for free. Nobody wants.
Sorry about that. Let's say you have a sister. Let's say you have a sister who's 40 years old and has no more good eggs. I think a 36-year-old younger sister could donate and do really well.
Yeah. Okay. No, but good to know, you know, at least you know that
Yeah.
if you're not gonna use them, they can be useful for somebody else, let's say, you know.
Yeah.
That makes me more happy and makes me consider.
Yes,
Can
I
I ask you
understand.
something else? No, because, you know, every time I think like, you know, I really wanted to do it actually, and then somebody told me it's very hard on your body, and then I thought like,
for all the people out there that are taking advice from their friends
yeah.
and are not doing things like egg freezing because their friend told them it's hard on your body, your eggs are going to be bad, I think it's worthwhile to spend an hour on a call with a doctor, going over it with a professional to advise you. And it is, I mean, it's all relative. Is it easier than laying at home on your couch? No. Is it easier than having to have like brain surgery? Yes. I mean, it's a little tiny shot that goes in your belly, and about 10 to 12 days later, basically we go ahead and have people come into office and in the surgery center with a 5-minute procedure. We take the eggs out and you're done. I mean, I think it's beyond easy.
Does it give you mood swings? Because I already have natural mood swings. I don't think I could take
So again, like I said, I think if you're 42 years old and you saved up your whole life the money to do this and you have no one in your life to go forward with it, I think it's going to be a little stressful time when you have to actually do this and realize the realities of your life.
That's true.
But I would look at it for whatever age, whether it's that 42-year-old, a 36-year-old that already has kids, you know, I would look at it as you're being a smart, proactive woman protecting your future.
Mm-hmm.
Simple as that.
Yeah, and
I
I
wouldn't
think
make it more complicated than it is. I wouldn't do anything more. It's a simple procedure to help your future.
that definitely makes sense, and I feel like people I've been speaking to who are like, I don't know, I don't think I want to have kids. It maybe could even just be like the freedom to still have the choice or to change your mind later down the road. You know, because you don't know. Like, I'd
rather have doors open for me when I get older than doors already all closed for me.
Yeah. Okay, cool. That was so helpful. Thank you, Dr. Ghadir.
No problem. Thank you guys.
Thanks,
I
dude.
appreciate you being open and teaching and helping everyone learn from our discussion. So thank you so much. Thanks for doing this.
Yeah. Yay! Bye.
Bye-bye.
You are amazing.
We'll FaceTime him now for you.